With thanks to the federal government, the Black Dog Institute is leading the National Suicide Prevention Trials, which is an Australian first. We're driving critical connections and partnerships, providing resources and education to build the capacity of a much needed workforce to reduce suicide rates in Australia. As research leaders and implementation experts, we're enabling delivery and scale of a systems-based approach to suicide prevention. Let's hear from our colleagues on the ground in the communities we support.
The motivation to start this work was one of my soldiers taking his life some time ago. What keeps me going is the knowledge that the work we're doing is impacting, changing, and indeed saving lives. I think one of the great benefits and strengths of working with the Black Dog Institute is we know we can reach back into the expertise that Black Dog offers. You know, it's a kind of internationally renowned organisation.
I think Black Dog Institute has provided great foundation. So when you're coming to this role, there's evidence-based, so you know what you're delivering has the evidence, so you've got the confidence to move forward with that, but also reaching out to the staff for their expertise and their guidance has been wonderful.
Everyone in the network needs to understand the lifespan model, and they also need to think about, okay, look, we need to operate collaboratively and as a system for tackling this issue.
The systems approach for us has been absolutely critical. And of course the audit data that we've received from the Black Dog Institute's been critical with that, because what that did was really help the work we're doing with the National Parks team around a particular suicide hotspot.
What I really found valuable was the access to the suicide audit data for our region, the North Coast, as well as specifically to the Clarence Valley. That's helped in our planning as well, which has been really good. I've also really appreciated the access to the Confluence website. There's a whole range of guidelines and templates and knowledge sharing on that, which has been invaluable. And also the support from the suicide prevention trial team.
We want to keep the momentum going. It's been a lot of building trust and building relationships and networking and talking and delivering training, and that's all been fantastic, but we need to now keep that going.
So it's all about promoting accessibility, and also for our community to know what the resources are that they can access. Right help for the right person at the right time.
I suppose one of the biggest successes is we've managed to train at least over 3,000 people in our community in mental health literacy training, and that's right across the whole cohort. I also like the fact that we've been able to go out to our community and really let people know any events whatsoever that we do, where they can access help, how they can access the help, and who they can go to.
We've actually had people come up to us in the street in Townsville to say, this has changed my life. Trust in the system. That lifespan model is pretty effective.
I know that we are making a difference.